Well, now that school has been back in session for a few weeks, parents, you may have a child who's struggling a bit with the transition. In this week's Mom's Minute, we're talking back to school anxiety. DrLiz Matheis is a clinical psychologist and a mom of three, so you know a thing or two about some of the challenges kids and parents can face when it comes to a new school year. So first of all, thanks for being with us.
Thank you.
Tell me a little bit about what you hear from parents and your clients and kids about some of these challenges and really how common this is.
It's a lot more common than you think. And what I get a lot of phone calls about is my child is acting out. My child is behavioral. And my philosophy is no child wakes up in the morning and says, I'm going to be behavioral today, so there's a reason.
Right. And so you have a couple, really some symptoms, some specific symptoms that parents can look out for in terms of if their child is actually experiencing back to school anxiety or school related anxiety.
So what we see a lot this time of the year is just a heightened level of agitation, especially with our teens. So we think this is normal because they're
teenagers.
This is what goes with it, but it's a heightened level of agitation where things that normally wouldn't bother them now bother them. That for younger kids, they're having meltdowns. They're having meltdowns about the idea of homework, not even having to actually do it. Things like getting ready in the morning, things that wouldn't normally create meltdowns, you begin to see the difference, and that's your sign.
And another thing you said that can sometimes happen, headaches, stomach aches, little things that, complaints of that can sometimes be an indication of a bigger problem.
Well, yes, there's, I always like to look at the physiology first. So we need to figure out, is there something else maybe that's going on? And if we manage the anxiety and the experience of headaches or stomach aches decreases, then we know is anxiety related. But I've had parents come in and they've tested up the wazoo for like celiacs and
all these
diabetes
right.
and this and that, and then once they rule it out, and some parents just need that confirmation, which is absolutely fine. But yeah, you do see a lot of headaches and stomach aches, and if you take a look specifically at when it's happening, it's usually around the transitions of going to school, transitioning back home, transitioning from home to an activity, or even at bedtime.
And you said that avoidance is another big thing that you often see. I mean, that seems to be a pretty obvious one, just not wanting to go to school or just not wanting to do things that they would normally want to do.
Things that were once fun, things like playing with other friends, staying at the playground maybe a little bit after school, or doing things with the family, and now they're like, no thanks. So that's a sign that something's going on.
And last but not least, sleep is always a big thing when it comes to transitioning back to the school year. But you say, be mindful of that if you see changes.
If you see changes where kids are actually sleeping either too much or too little. So a lot of children will struggle with falling asleep because they're anticipating the next day. They're thinking about the next day and the fact that another day of school is coming.
Right.
So they have a hard time settling down. So that's a sign. Or they are coming home and falling asleep and they're sleeping till maybe the next morning. So over or under sleeping.
So a lot of good things to look out for. Coming up in our next hour with DrLiz, there are solutions. That's the good news for parents to address this. You can find out more about DrLiz at news12.com as well.